Okay, so the pelvic girdle is made up of two bones. We've got the coxal bones right here. Those are the two bones that we have to know if they are left or right. But anyways, those coxal bones are made up of another three bones called the ilium, the ischium, and the pubis. So those three bones fuse, I think when you're 23 or something like that, but they fuse and they become just the one coxal bone. So if we look here from the back, we can see a little bit more clearly the ilium. It's the big part. Loki, it looks like a hand, Loki. So this big part right here, this is the iliac crest. And then down here, we've got a little curve, and then we've got the ischium. You can see another side over here. This right here is the ischium. Right there too. This is the bone that we sit on. Whenever we sit, this is the bone that we sit on. And then forward, moving forward, you can see some little bones right here, and then they meet in the middle. Let's just go over here to the other side. Boom, boom, boom. Oh, it's kind of angled weirdly. Okay, that's fine. So you've got these two bones from the ilium, and you've got these two bones, parts of the bone from the ischium, and they meet right here in the middle, and they create what we call the pubis bone. This right here, this little rubber, is a cartilage. It's supposed to show a cartilage. That is the pubic symphysis. That is a cartilaginous joint, amphiarthrosis, if I remember correctly. What else is important about this? Oh, we've got the false pelvis. So that would be from the iliac crest to the other iliac crest. Whoops, there you go. So some people think like this is the hip, but that's the false hip. This is the true hip. This is your pelvic inlet. I guess you would call it the true pelvis. So you got the pelvic inlet, and then down here, you see where these two little things are? That's the pelvic outlet. That's where you have your baby goes in through the pelvic inlet, out through the pelvic outlet. Your baby, what the heck? Whatever. Okay, we checked the ilium, we checked the pubis, we checked the ischium. The articular surface. The articular surface is right there. That's where you meet your sacrum and your ilium. That's the articular surface. Your acetabulum, you can see it really well right here. It's this rounded part that the head of the femur, almost said humerus, that the head of the femur goes into. So it fits right there. You can see it's rounded, so that way we can walk, open our legs, abduct and adduct our legs. So I got articular surface, we got acetabulum, pubic symphysis. Couple things. Obturator foramen. Those are the biggest holes in the body. The obturator foramen. There is supposed to be like a obturator foramen membrane. It covers it, but it lets nerves and blood vessels through. Pelvic inlet, pelvic outlet. Already mentioned that. And then you've got the pubic arch. I can see right there. Oh wait, can we move this? Pick this up. Let's not pick it up. Anyways, you've got your pubic arch. Your pubic arch is formed by these two pubis bones, and depending on how wide or narrow this pubic arch, you can tell whether a pelvic bone is a man or a woman's, for the most part. Now, if we have a narrow pubic arch, like less than 90 degrees, that would belong to a man. And then a wider, I guess, pubic arch, that would belong to a woman. Makes sense because women have to give birth, so the bone can't be in the way. Another bone that can't be in the way is the sacrum and the coccyx. So in a man, the sacrum and the coccyx will extend further out than in a woman's. So here, what I'm seeing, I'm thinking, I can't really pick it up, so I can't see the pubic arch too well, but I think this is a man. That angle looks pretty narrow. The sacrum is extending well into the pelvic outlet, so that would be, obstructing the baby. How to know if this is a left or right? Your pubic bone is gonna be facing anteriorly, and then you're gonna have to face the sacral ala posteriorly. Another way, the last check, you need three things kind of. The articular facet has to be pointing medially. So this line has to be pointing medially. So of course, right, I can grab this hip bone and put it on this side, and the pubis is facing in anteriorly. Your ala would be facing anteriorly, but the articular surface would be facing the wrong way because it would be facing that way. So it has to be facing medially. Okay, leg, lower extremity. We talked a little bit about, oh shit, this is facing the wrong way. Okay, there we go. There we go, she's looking better now. Okay, so we've got the legs so messed up a little bit, but that's fine, whatever. Okay, so we've got the femur, and real quick, we have the head, really, really big head, and the neck. So whenever people get injured, it's mostly the neck that gets, whoa, that's not it. It's mostly the neck that gets injured because it's really thick here, but this part is really, really thin. So this doesn't have that much work. So it'll crack. The head, the greater trochanter, and the lesser trochanter. Let me see if I can get a good angle. Greater trochanter here, lesser trochanter here. Those are just muscle attachments. You've got your shaft or your body. Wait, this isn't backwards, is it? No, this is fine, So we've got the lesser trochanter, greater trochanter. This thing's huge. Let's see what else. Distal end, we've got the medial and lateral epicondyles. Oh, well, you can't really see that here. Oh, God. So down here, you got your condyles. The part that I'm touching here is your medial condyle. And then on this side, you've got your lateral epicondyle. Up above, you have your epicondyles right there. And then you've got one over here. Those are your epicondyles. Those are the medial epicondyle and lateral epicondyle. Those are connections for muscles and ligaments, so that your knee joint can be more stable. Your patellar surface, that's where your kneecap sits. It's on the femur, so it's right there. It's patellar surface. What else? Intercondylar notch or intercondylar fossa. That is on the posterior. So, if you look over here, oh, look at that, perfect. You can see this notch. It's pretty deep. So these are your condyles. It's a little bit easier to see them on here. These are your condyles. So you got lateral and medial epicondyle, and then your intercondylar fossa. That's for your, what is it called? Your tibia to be able to rotate in there. So you can kind of see this little groove right there. Perfect. You see how it fits right there. Okay, that's that for that. The way that you can tell if you've got your left or right, pretty easy. I think it's easier than the other ones. You have your head, you point it medially, and then you have to check, is the fossa facing forward or backwards? Is your intercondylar fossa facing forward or backward? Remember, it has to face backward. So I guess you could do the opposite. You could put your intercondylar fossa backward and then see which way the head is pointing. So if your intercondylar fossa is facing backward already and your head of the humerus is facing to the right, you've got, yeah, that's the right? It's facing to the right, then you've got a right femur. If your, well, it depends. Oh my God. Actually, I shouldn't say that because then, okay, let's just say they give you a bone. Imagine you're gonna put it against your own leg. You've got your intercondylar fossa is facing, back like it would be your own leg. Then look at the head. Okay, the head is pointing medially. You've got a right femur if it looks like this. And then here, intercondylar fossa facing backward, head is pointing medial, and then you can be like, okay, it's gonna be your left leg. Just imagine you're putting it on your own body. Okay, patella is just your kneecap. It is enclosed. Okay, it's enclosed by your, is it tendon or ligament? Ligaments, because it's bone to bone, I believe. And oh, actually, it might be a tendon. Let me see. Where did I write it down? It seems like I did not write it down. But it might be your quadriceps femoris and your patella. So that would be a tendon, because tendons are bone to muscle. Anyways, lower leg, tibia. Tibia is medial, and you've got your, oh my god, what is it? Fibula, oh my god, holy cow. Real quick, right away, tibia, way thicker than your fibula. Your tibia would be that shin bone that you can kind of feel on your leg. You've got your tibial tuberosity, right? Tibial tuberosity, yeah. Let's see what else. You've got your condyles. These, I would honestly, personally, I would not call condyles, because condyles are rounded, but I mean, they fit with the condyles of the femur. You've got your medial and lateral, and then medial lateral condyles, tibial tuberosity. I can see the tibial tuberosity. I think I already went over that. Your distal end has the medial malleolus, which is like a bump in your ankle. You can kind of also, oh my god, my socks. It's like right there, you can feel it. Okay, whatever. Go feel that right there. And then you've got your fibula. This one, holy cow. This one's might be a little bit trouble, because you've got it, it's skinnier. You're gonna be able to tell that it's your fibula, but it's kind of weirdly shaped. I can't really tell it apart when it's on its own. But you've got your lateral malleolus. So it's another bump, but it's on the lateral side of your ankle. For this, if they ask me if it was left or right, I'd give up. No, I'm just kidding. I can tell that this is really sharp, and the back end has a slightly rounder edge. So I would put the sharp end forward, and then I would look at the malleolus. Is the malleolus, I'm imagining that it's on my leg. Is the malleolus on the left, or is it on the right? So if you've got it on the left, you've got a left fibula. If you've got it on the right, well, you've got a right fibula. This right here would be the connection. Homework says the fibula does connect to the femur. Dr. Waggle says it does not. So I think I'm just gonna go with Dr. Waggle and say that it does not meet it. It does not articulate with the femur. Fibula, head, lateral malleolus. Oh, look at this head, man. Look at this head. There we go. Head of the fibula. Head of the condyles of the tibia. Your tarsals, the only ones that we have to know are the calcaneus. So you've got your calcaneus right here. Boom, boom, boom. It's the big heel bone. These two, your proximal ends of the tibia and fibula, they articulate with the talus. You got it. Talus carpal. You don't need to know the carpals either. Yeah, no. Phalanges, proximal and distal ends. Proximal articulate with the tarsals, and then the distal articulate with the phalanges. Your hallux is your big toe. Oh, on your hand, your pollux is your thumb. So that's that. And I think we're good. Cranial point, and those are joints. Okay, we're good though. Okay, we're fine. We'll see if we know all the other ones later.